Lights, camera, compassion. Lights, camera, compassion. Lights, camera, compassion. Good evening, everyone. How y'all feeling? Belly's full. Get up, walk around. I see the bars had a line all night long. Good job. Tip your bartenders. Tip your bartenders. It's come to the time of the evening where I am going to introduce you to someone special to me, not just because of what I do, but because of who he is. I have this big, long speech written out, but I'm going to be honest with you, I copied and pasted it from Wikipedia. I just want to come from my heart. I want to take this time to personally thank you, Dr. Harvey Sloan. It is because of your run that I can walk. It is because of your great works that I can stand here before all of these wonderful people. It is because of you that I can look at a single mother who's bringing her child into our healthcare facilities and let her know it's going to be okay. It is because of you that I can look into our fastly depleted, income-driven community and say, we're opening a food pantry. It's okay. It's okay. You don't have to worry about how you are going to pay for your prescriptions. It's okay. We have a fund for that. It is because of you. So I want to take this time to not only introduce you to everyone else, but I want to personally thank you. You paved the way for myself, for Dr. Jett, for Mrs. Sean, for Dr. Dow, for Dr. Jacobs, for everyone at Park Duval. Park Duval staff, could you please stand up? Stand up. Everyone that works at Park Duval, all of our staff, everyone, no matter what you do at Park Duval, please stand up. This is because of you, Dr. Harvey Sloan. We are here because of you, and we thank you. So I could read off everything that Wikipedia says, but you can do that yourself. I want to thank you for everything that you have done for Park Duval, for our communities, not just one community, not just two communities. We serve 5 communities, and it is because of you, and we thank you. So everyone, I introduce to some, I present to others. Welcome with a round of applause. If you want to stand up, please stand. If you don't, you are a hater. Please stand and welcome Dr. Harvey Sloan. And he's looking good, y'all.
Gosh, what an introduction. I've never had anything like that. I'm not even dead yet. I mean, you know. This is so wonderful to be here. First of all, of the things I've done in life, is the number one. And I remember those early days. Can we reminisce just a little bit? I came down here in '64 and was part of President Kennedy's Appalachian Health Program. In those days, they didn't even have Medicaid. So I said, I have got to get somewhere where I can not only diagnose, but help treat people that are sick. So I got to know Mrs. Bernice Hunter. How many of you remember Bernice Hunter? She was a remarkable lady. She was about 65. She had had a stroke. She was the leader of the Park Duval community. Her claim to fame was that she wanted to get a light at the crossroads of Wilson, where the kids crossed to get back to home. And City Hall didn't respond to her. So she took her cane and went out in the middle of the road, the highway, on rush hour, directed traffic east, west, north, and south. And I assure you, it was just a giant screw-up. I mean, everybody was going everywhere and they couldn't get anywhere. And City Hall came down and said, Mrs. Hunter, look, we don't want to arrest you. If you just give us $1, we'll call it a day. She said, I'm not leaving till you get that light on there. They got it there the next day. So, yeah. So I was introduced into the Park de Ball neighborhood community. There were people like John Thompson, there were people, Mrs. Rosemary Cook, Mrs. Bruce, Ms. McCormick. I mean, they were just really wonderful people. And we finally got a proposal together. Now, we didn't have any support outside of Park de Ball. The medical community thought, well, this is socialized medicine. Don't let them in. These federal doctors, they'll come in and take your money and leave. So we finally, we couldn't even get the dean of the medical school. We couldn't get the head of the Jefferson County Medical Society. Even the African American Medical Society didn't support us. So we finally got this application out, and I've spent my time going between Washington and New Orleans. Anyway, it got funded. That was really one of the happiest moments of my time. And that is when it all started. We had people that were committed to other people and to health care. And that was 1968. Now there are 186 different community health centers in Kentucky. Nationwide, 40 million people are served by over 14,000 community health centers. It is a victory. It's a victory we've got to keep and expand. And if they chop into the community health center finances, which they may well, we have got to fight, fight, and fight. Do not do that. Do not touch what is sacred to this community. Do you know how many people are served by community health centers nationwide? And they're well over 16, 18,000. 40 million people. Now that's a bunch of people. And most of those centers are on the edge, basically struggling. And Medicaid is being chopped off here and there, and it's getting tougher and tougher. So we've got to fight. As I mentioned at the rally, I quoted our senior senator, Mitch McConnell. He was having a discussion with his assistants and with his community people about the future of Medicaid. And he thought after a while, and everybody was yelling and screaming with him, you know, they'll get over it. Well, folks, we're not going to get over it. We're just going to fight and fight and fight. Yes. And my friends, it's a long road. We're talking about $1 trillion out of Medicaid. $1 trillion. I didn't take mathematics, but good Lord, that's a lot of money. lot of people, a lot of money, actually. I mean, and Medicare is a $500 billion they're taking. This is the biggest deluge of destruction I've ever seen or read about in this country. And we've got to stop it. That means, what do? Well, we've got to learn what is happening, what is being sacrificed, so we can fight to see that it isn't. Secondly, we've got to elect state, federal representatives that have it in their heart, soul, and total being to rebuild Medicare and Medicaid so people can live. You know, when I came in with OEO, there was an adage: the sick get poorer and the poor get sicker. That's not changed, folks. That's still the case. If you take away their health care, they become sicker, they can't work, and their families are going to be absolutely decimated with inability to take care for themselves. So Park the Ball is the beacon of hope, in my opinion. It was the 7th center in the United States of America, 7th. And it has blossomed, it has grown, it's serving more and more people, and there's no way we can't let this demise. We've got to fight, and we've got to make sure that what we do is to fight right and not just talk about it. So tonight is part of me, what you've done, and I have to introduce my family that has supported me emotionally, physically, and every other way. And it was Abigail, please stand up. Patrick, please stand up. Curtis, please stand up. That started this fund for patient care. And you've got to thank them for that. So where do we go? Well, we're going to make sure that everybody understands what's happening. Many people don't. It's so humongous, I don't fully understand it. I mean, it's going to affect hospitals, it's going to affect nutrition programs. Can you imagine Head Start is no more? All the programs were started by the Great Society and helped so many people are being chopped away. How could they do that? Where is their heart? And why won't they help us fix it? So this is the beacon of hope, in my opinion, in this country. It's community health centers like Park the Ball. You're the 7th in the nation. Everybody looks to you for guidance and for what you've done. And, you know, these health centers have been examined up and down and analyzed, and they're standing strong. So thank you for what you've done tonight to me, my family, and God bless you, and let's keep fighting. Is that okay?
Dr. Harvey Sloan, before you leave, our CEO, Dr. Swanee Jett.
Well, thank you. I appreciate it. This is from one CEO to the next, from the first CEO to the last CEO.
Okay, my friend. Thank you so much.
Thank you.
Ladies and gentlemen, Dr. Harvey Sloan. All right. Ladies and gentlemen, it's the time of the evening where I recognize all of our lovely sponsors. In a world where low income is rapidly becoming no income, your contribution is extremely important, not only to Park Duval, but to the communities that we serve. And we thank you. I want to personally take the time out to thank all of our sponsors. I promised our executive team that if we raised $10 million tonight, I would cut off all my hair. I did my part. It's time for you to do yours. Our golden reel sponsor is the Tantalum Partners. Thank you. Our entertainment sponsor, PNC Bank. Thank you. Rising Star sponsor, Cozair for Kids and Assured Partners. Thank you. Media sponsor, Wave 3. Thank you. Table sponsors, A.D. Porter and Sons, Cafe, Jacobs Remodeling, AHEC, Park National Bank, Republic Bank, Churchill Downs, Boys and Girls Club, Manna, Manolia Passport, Mike Ward, the Louisville Urban League, Theta Omega, AT&T, Crescent Travels. Our photo booth sponsors, MSD, Mutual of America. Thank you. Our cocktail hour sponsors, Anthem, RNDC, Tito's Homemade Vodka. Y'all not gonna clap for them? Thank you. Our valet sponsors, NCS. Thank you. Our paparazzi sponsors, MSD, Russell, A Place for Promise. Thank you. Our paddles raise sponsors, Paylocity and Exposure. Thank you. We thank each and every one of our sponsors for your contribution to make this evening amazing. But the job is not done. There are still people who need you. There are still people who desperately need the help of Park Duval Community Health Centers. And I don't want to sound cliche, but you can sponsor a child for the low, low price of $10 million, because I need my hair back. I need my hair back. I'm going to bring back to the stage Mr. Kevin Bruce.
Thank you. I want to introduce to you our CEO, but I want to take a moment and just talk very briefly about who he is. So many times I am places and we have this wonderful media thing at Park Duval, and people will walk up to me and they'll say, "Aren't you the chair of the board of Park Duval?" And I say, "Yeah." They'll say, "What's Dr. Jett like?" Saying, wow, that's kind of weird. But it's funny because the one thing I realize is that Dr. Jett is more than just the CEO. He is a physical walking embodiment of Park Duval and the beliefs that we have. And so sometimes when you get so many awards and you get accommodations and you get other things, the humanness in who you are gets lost. So people don't know you as Swanee. They know you as Dr. Jett. And so I have had the pleasure of traveling with Dr. Jett, spending intimate time. We've been together to San Diego, to Los Angeles, to Chicago, to Atlanta, to Orlando, and to other places that I forget. Now, I could read you the bio, but you see that on CEO Live Talks. The one thing I want you to know is that in all of these places we've been around some of the biggest names that you hear of in this country. The one thing that's never changed in every conversation, whether it's one on one or whether it's in front of other people, is this: I'm only concerned about the people. I'm only concerned about doing the mission. He says there are so many children whose idea of dinner is a McChicken, chili cheese Fritos, and a Dr. Pepper. That should never be the case. Every child deserves, Kevin, to have green beans, vegetables, salad, things of that nature. When we talk political, if you know him, he has his opinion. Um, but his biggest concern is let's not abandon the community. So we are living in an era where we have a shortage of doctors. And so now what we see coming into the industry is a huge number of nurse practitioners. And so the stats tell us in the next 15 years, for every one doctor, we'll have 73 people that need healthcare attention. That is a fight. And so you have to have somebody who never gets tired. And so we'll be in conferences. I'm leaving to go to the room at 12 o'clock. Dr. Jet is walking around because he's hyper. And at 6 in the morning, he's on the treadmill. And I'm like, Doc, we're at a conference. He's like, I don't care. I got to get up, I got to get going, and I got to make sure that I'm ready for this fight. And so the person that you see is somebody who really cares about the people. And the only agenda he has is to bring fairness to the communities he serves and the communities of the colleagues that he works with. So would you do me a favor? Would you stand on your feet and would you put your hands together for our CEO, Dr. Swanee Jett?
All right. All right. Wow. I am overwhelmed, to say the least. You know, I'm shocked at the acknowledgement and the praise. That's the video from the staff and Mr. Bruce. You know, so thank you, thank you. I never take that lightly because you know I was told years ago, and I still laugh at Mr. Ryan Irvin, one of my first bosses. He said, "You'll never expect to get praise or accolades for the work that you do." Um, so we got some serious things to discuss tonight, and so you know I'm gonna get us down the road because Midnight Star probably is ready to dance, ready to sing. I'm pretty sure we got the mics queued up. You know, a disciplined man keeps moving forward when no one is watching because his standard isn't set by praise, it's set by purpose. In Proverbs 3:5, in all thy ways acknowledge God, and he shall direct thy path. And he's directed my path. But I say, what a star-studded night, right? Everybody in this room is a star. Everybody is beautiful. Everybody is graveyard ready. Don't die. That's right. Hey, instead of casket ready, graveyard ready. Special thanks to the dignitaries. Special thanks to the sponsors. Um, I want to thank my board. Can you please stand up? Give me a hand. And special thanks to my board chair. Special thanks to my staff, my committee. Can you please stand up? All right. And where's Miss Yvette Hudson at? All right, when you see her with the red dress on, all right, please give her a shout out. She did wonderful helping me coordinate this and our team. So it's a lot of work. And then I want to give a special thanks to my wife. Can you please stand up? Now, you can sit down. Hey, I'm a hard driver even at home, right? I don't take it lightly. I expect excellence in everything. And then, I'll be remiss. Where's my sister at? Sister Kenya Jett and her husband Ali. Let's give her a round of applause. She came from Chicago. And then if you haven't met this beautiful young lady and man, my mom, Diane, and Matthew, please stand up. Mom and Pop. So, for all of you that's new to Park Duval, you have heard the history. It was started in '68 during the civil rights movement by civil rights leaders who marched for access to health care. Park Duval Community Health Center was the first, not just in the city, in the state, and one of the very first in the nation to be created. Its first CEO, which you have met, is Dr. Harvey Sloan, who eventually became mayor. And he has a book out too that talks about his journey. Park Duval established the first ambulance service in the city because African Americans couldn't be transported to the ER. And Dr. Harvey Sloan is still fighting to this day. He called me a couple of weeks ago. Yvette Hudson called me 10 times and said that Dr. Sloan wants to talk to you. He's getting a rally together to fight for Medicaid and to fight for the other cuts that's happening by the administration. And I said, well, hell, I got to be there, right? And so I showed up at 9:30 to give a speech. He's still fighting to this day. I hope I have the power and the will to fight for another 30, 40 years. That's really remarkable. So tonight's theme is lights, camera, and compassion. I still believe that healthcare is a human right. Park Duval continues to expand on that belief of social justice and human rights, which is the premise of our existence. It was supposed to be more than healthcare, but a beacon of hope. Today, Park Duval is at 5 sites, and we will expand to 6 in the West End School in September. We will open an immediate care center next month as well. Finally, in October, we plan to open a state-of-the-art indoor farmers market born from a concept, in my brain, of course, deeply rooted in our community's need for healthy, sustainable, sourced, fresh food. The farmers market will feature a demonstration kitchen, fresh from the land and farm-to-table produce, as well as a food pantry in partnership with Dedicare. God is good all the time, and all the time God is good. In 2024, we saw 14,000 patients. We had 3 face-to-face interactions with 42,000 patients last year. That number includes dental, adult medical, pediatrics, women's health, and mental health. We serve people in rural communities and urban areas from Eminence to Louisville. And 11,000 of our patients are below the poverty line. We provided 67,000 prescriptions last year, 1,500 vaccines. And also, we are making strides with screening people for HIV, which we still have an epidemic in Louisville on the west side. We are enrolling people as we speak into treatment. And so that's why I created the director of HIV in order to reduce that burden on the community. Our lab is still ranked in the top 2 in the state, which a lot of people don't know, right? So we are doing God's work. And last but not least, how about CEO Live Talks with Dr. J? Let's give up those 7 Telly Awards. Now, it wasn't me, it was people telling interesting stories about the work that they do in the community, right? And constantly highlighting that and putting that to the forefront. We have people doing the work in the community, and we need to support them. If you haven't seen the show, it's on Wave 3 at noon on Saturdays. Now, before I end on this farmer's market, I'm gonna go to something else, but I want to close on farmer's market part. As for the farmer's market, our patients will receive a 20% discount on food through a concept that I come up with, food is medicine, which will treat food the same way as we treat blood pressure medicine. We will prescribe food to our patients who navigate chronic diseases. We understand how our patients have been pressing needs and economy that sees them making decisions between food and medicine. We want to eliminate cost as a barrier to health. We want to do this and bring it to them for free if possible, but we need your help. We can help create space to demonstrate, nurture, grow organic love. That's what Park Duval Farmers Market can do. It is something that is a tangible symbol, a lasting legacy of change, a demonstration, a movement, a place to nurture and literally grow love, not hate, from soil to water with the intention and the care of people that it will sustain so that it can sustain us as a community. Recognizing that our health and wellness is tied to that of our neighbor and deciding to give aid when the neighbor is in need, that's what justice looks like, right? That is community. That is caring. That is compassion. That is Park Duval. And despite the current environment, I'm fighting to improve the community, not just healthcare. That's just one part of it. Community cities were established to do a lot more, right? Social injustice anywhere is a threat to social justice everywhere. That means I have to be more than a CEO. I've had to morph into becoming a champion of the people. The people's champ because my focus is on amplifying your voice, the community voice, and being an advocate for our community that was made vulnerable and left behind by the very people charged with ensuring its viability. See, I started this mission as a health commissioner, and I was taught to have a lens and a voice for the people and use your platform to magnify the voices of the people, a human rights leader. And from a young age, I was taught by my mom to work hard. And so many nights, she saw me just drawing, doing art, painting till 12 or 1 o'clock in the morning. Got up the next day, 6 o'clock in the morning, went to school. That drive still fuels me today. Why? Because we're at a precipice of an internal war. Where's the love? Where's the love for our fellow citizens? We are in a fight for our livelihood. Our world is predicated on the ramifications of capitalism and greed, which is a synonym. Or is it? In 2020, I stood up to Trump administration during COVID-19. They wanted nobody to wear a mask. They said asymptomatic people did not need to wear a mask. I knew that was false. So I passed the first mask mandate in Brookline, Massachusetts. I stood up to the local government that wanted to destroy a smoking ban in Bullitt County. I provided H1N1 vaccines to citizens when other communities were holding the vaccine. I did not want one person to die on my watch. One person did die in Louisville, but not in Bullitt County. I went to Africa to fight against Ebola to ensure it didn't reach our shores. Now, okay, I admit that one. I might have been a little senile. But collectively, we stood up to society for our well-being. So I'm asking you because I'm unapologetically standing up for our people now. So you can hate me now, but I can't stop now. I won't stop. Right? It's time to discontinue hiding in the shadows and dissipating on the sidelines. How long will we as a nation ignore Medicaid cuts? Right? To 30% of Medicaid recipients and 47% are children. Right? There are threats to Social Security. Hell, I want my Social Security. I put a lot of money in there. You send me a damn check. Right? Diversity, equity, and inclusion is disappearing from a society that needs diversity. Now, make that make sense. Right? We can't make America great again without diversity of its people. The last time I checked, I ain't picking no strawberries or oranges on the farm. Hello, ring, ring, I got red bottoms on. Come on now. Right? There are people from other countries doing the labor. Let's keep it real. How can we ignore the past as though there are no consequences of our previous actions in this society? Check this out. You and I know slavery did occur. Lynchings did occur. People were buried in unmarked graves, and to this day, their lineage still grieves for them. Over 400 massacres did occur. The Great Plague did occur. Polio scared the hell out of Senator McConnell's family. Hello, ring, ring. Vaccines did save people from polio, measles, and numerous other diseases. Yet today, anti-intellectualism, anti-intellectualism, right, threatens to return to the days of rampant disease spread and scarce vaccine supply. Now, I don't know about you, but somebody that's anti-intelligent, something's wrong, right? Ain't nothing divine about that. There is nothing divine about that, right? Losing a kid due to refusal to get a vaccine, that is stupidity, right? The same stupidity that led somebody to drink that hydrochloroquine and died because they was listening to the president. Hello. That happened during COVID. Oh, did I say that? You can hate me now, right? But I won't stop. I can't stop. Somebody got to tell the truth, right? It will set you free. And are we ignoring somebody talking about we're going to put up Confederate flags and statues again? We're going to rebuild that legacy? I thought the Union won the war. I am so confused in America. Man, let me repeat. Didn't the Union win? Man, I thought we trashed Jim Crow. I ain't going to the all-white bathroom. I'm sorry. Right? I ain't going to all black bathroom either. Better just say bathroom. I'm just saying. Somebody has to create a path for our future generations. And we are the somebodies that the world is waiting on. Right? It can happen here in Kentucky. It can happen here in Louisville. Right? We've had some of the greatest people come out of Louisville, Kentucky. Hello. Right? We can't all spend our time traveling. I mean, I like to travel, but we can't all do it, right? While people are suffering and walking through carnage. We are at a precipice of a collapse as a society. Now, I'm going to take you back. Y'all might have heard of this person. Like, on April the 3rd, they gave a great speech, right? 1968. Check this out. This is just an excerpt. I know, strangely enough, I would turn to the Almighty and say, if you allow me to live a few more years in the second half of the 20th century, I will be happy. Now, that's a strange statement to me because the world is all messed up, right? The nation is sick. Trouble is in the land. Confusion all around. That's a strange statement. But I know that only when it's dark enough, you can see the stars. And I see God working in the period of the 20th century in a way men, in some way, are responding to something happening in the world. The masses of people are rising. And wherever they are assembled today, whether they are in Johannesburg, South Africa, Nairobi, Kenya, Accra, Ghana, New York City, Atlanta, Georgia, Jackson, Mississippi, or Memphis, Tennessee, this cry is always the same. We want to be free. Now, I couldn't have wrote that speech. That was Dr. Martin Luther King. And on April the 4th, when he died, I was in her belly. She was going to prom, dancing, right? So you see, how can I have this same debate, argument, call to action, demonstration from back in April the 3rd, 1968 in Memphis, Tennessee? Hello, the world is messed up. And we have a problem, right? So my mom couldn't imagine in 1968 that I'd be giving this speech. She was just hoping that I heard me get the hell out the belly, right? But you see, there's so much that has been accomplished, and yet there's so much that has not been in its 57 years since. And I'm not even close to the mountaintop. I'm still climbing. We are at a precipice of the divisiveness of committing suicide from within. So you can hate me now, but I'm injecting the world with love, as Dr. King would. When the Chinese dictator says all great regimes must fall, I'm sure somebody caught that in. It's us. So I have a call to action for us to remediate the internal problems and eliminate the divisiveness. We are not Russia. We are not China. We're supposed to care about human rights, civil rights, hell, common sense rights for the people. Will the Spartan 300 stand up with me? Are you with me? Will the Shaka Zulu warriors stand up with me? We need you. Everybody has goals and dreams. I'm sure I'm putting some pressure on you. I'm so sorry. Right? I get it. You got ambition. But I challenge you tonight to have a purpose to help me reclaim, reshape, and help others. Many of you are in the room, you're fighting with me. For some of you in the room that might be scared to fight, I kindly ask you, please step aside, right? I'm so sorry. You can hate me now, but I ain't gonna stop, right? You could become mad. You need to be mad. There's injustice happening to millions of people. People are losing their jobs for the sake, 21,000 jobs, by the way, for the sake of political ambition and retribution. I am so sorry, but an injustice to one of us is an injustice to all of us. The scripture tells us about being of community and helping people. Can we really afford to send in the National Guard to remove the homeless with no homes? Can we really afford to remove regulations by the EPA for air pollution in Louisville when people still are having respiratory illnesses and are affected disproportionately? Can we really ignore gun violence taking the life of a mom, walking her kid to the bus stop. Can we really afford to ignore race when racism still exists? And big groups march with masks on in Louisville and other places, hiding behind masks. Not the mask to save lives, the mask that hide their identity. Don't be scared. Show us who you are. I want to see. Can we really afford the bub? Oh, y'all don't know what the bub is. That's the big ugly bill. Can we really afford the big ugly bill? No. Knowing it will only serve to perpetuate intergenerational poverty and disenfranchisement among historical marginalized populations. Now, are we talking logic here or gibberish of a child? Oh, my bad. My 6-year-old daughter command greater linguistic vernacular than I hear in the media today. It's time to stand up and fight. It's time to march and protect. It's time to wake up and quit being bamboozled, hoodwinked, and led astray. The time is now, right? We need to be marching and protesting against the injustice that we see. We can't hide anymore. They done found out all the game. We need to stop this madness before there's no longer a future to fight for. It's time to begin to stand up for the hate and not allow it to seep in. What is your legacy? What are you going to dedicate your life to? Me, my life, my mission is to dedicate it to something that will outlast me. Thank you, and may God bless you.
Well, good evening, ladies and gentlemen. My name is Tanner Roberts, and I am going to be your auctioneer this evening. I'm so excited to be here. I do have some bad news. Everyone is going for second place as best dressed tonight because my man right here is best dressed. Let's give it up for him one more time. I'm always privileged to be in the presence of world changers, ladies and gentlemen, and I truly believe this right here is what I call a world changer. If you believe that, give him one more round of applause tonight.